Lisa, do you have a limit on BMI for arm lift, boob lift? Yes and no, Lisa. Yes, because it's 30. No, because it's not written in stone. So if someone asks me, I'd say 30. I'd say 30 is better to be a BMI less than 30, basically. Now, sometimes people will say not doing it unless it's whatever, 30 or whatever. I don't have a specific thing where I'll say, look, I won't do it. I try and have a conciliatory sort of partnership with patients to say, look, there are studies which say you're going to have a better result, less risk of complications if your BMI is less than 30 than if it's above 30. Now, I do surgery on, or at least I have done surgery on people with BMI above 30, but these are usually people who've lost a significant amount of weight. And the important thing is they're happy with their weight. So the first question is, are you happy with your weight? Because if your BMI is above 30 and you're happy with your weight, you don't really want to get it falsely below 30 just for surgery, then put it back on again. So if you're happy with your weight, that's one thing. Now, if you're not happy with your weight, and I understand it, you might say, look, I'm not happy with my weight, but once I get my tummy tuck and I get my arms done, they'll be able to exercise better because I've got this big apron here and my arms and all that. I understand that. But if you're not happy with your weight, you're much better to get your weight down first, because you don't want to have significant weight fluctuations after surgery. You really want to get your weight right first before surgery, because if you have significant weight fluctuations after surgery, it can have an unpredictable result on the effect on the result. So really, you want to have a stable BMI, ideally below 30, but doesn't have to be below 30. But if you can, particularly if you've lost a lot of weight, sometimes if people have had a BMI of 45 and it's gone down to 32, it's a bit harsh to sort of say, got to get it down to 30, because but yeah, the lower you get it, the better. Less risk of complications, and you're going to get a better result if you can lower. So it's for you, really.